Okay. Um, so arteries always carry blood away from the heart. Okay. Okay. And also things in the artery family. And we'll talk about those in a minute. So arteries and everything in the artery family always carry blood away from the heart. Okay. And they are oxygenated. So the blood that's inside of the artery family is going to be oxygenated. Okay, arteries are thick. So when you look at if you look down the barrel of the tube, okay, if you look down the barrel of the tube, they're very thick and they do not collapse very easily. Okay, so it's like this really strong hose that if you were to hold it and squeeze it, it takes some force to try to collapse it. And then even when you let go, if you squeeze the tube and then let go, it goes back to its original position. Okay. Now, veins don't really behave that way. Okay. Veins are collapsible, they're more flimsy. Okay. And we'll get into different reasons why. Um, and veins also have valves. Okay. So inside of the vein tubes, you are going to find one-way valves. And the point of the valves is to prevent backflow of blood. Okay, to prevent backflow of blood. And veins always go to the heart. Okay, so veins always carry blood to the heart. All right, so they return blood from the body to the heart. So, very simply put, okay, so the arteries are from heart to body, and veins are from body to heart. Okay, artery things in the artery family are oxygenated, and things in the vein family deoxygenated. Okay. So the pecking order, uh, referencing the heart. So the big tubes, starting with the heart, are going to be the arteries. And then those taper into smaller tubes called arterioles. And then the arterioles will drain into really tiny tubes called capillaries. Okay, and these are all oxygenated. And then the capillaries will drain into the venules. And the capillaries and the venules are going to be about the same size in diameter. So the tube is the same size. And the tube of the capillaries and the venules are basically just big enough to allow one red blood cell to enter. Okay, so in other words, you don't really see this. You don't really see a whole stack of red blood cells. They are single file. Okay, as you can see here, all the red blood cells are single file because the tube is that skinny. Okay, and when you have um, a red blood cell that's that close to the border of the tube, it allows for gas exchange out of the blood vessel and back into the blood vessel. So very thin, the skin of the tube is very thin. Okay, simple squamous epithelium. And the red blood cells very, very close to the border of the tube, which allows for gas exchange and all that stuff to be done very easily. Okay, then the venules drain into the veins. And then the veins drain into the great veins, which then will drain into the heart. Okay, so the layers of our blood vessels, okay, so they don't really say layers, they say tunics or tunica. All right, so we do have 3 layers. All right, so starting with the inside most let's see. All right, let's back up a little bit. When you look down the barrel of the tube, okay, when you look down the barrel of the tube, that all that space is called the lumen. Okay, so anytime you look down the barrel of the tubes, they call it a lumen. And then here's the lumen of the vein. Okay, so the lumen or the wall of the tube is lined with the endothelium, okay, the simple squamous epithelium, but it's the inside most, so they call it the endothelium. And this needs to be smooth. Okay, you want it to be smooth and continuous. Okay, the reason for the smoothness is so that the red blood cells and all the other stuff that floats around in your blood is not disrupted. It doesn't get irritated. Okay, when a red blood cell is traveling, it prefers to travel along something smooth rather than along something that's bumpy or coarse or irritated or damaged. Okay, all sclerotic and that kind of thing. Because the roughness of the lumen starts to hurt the red blood cells. Okay, and all that kind of stuff will lead to different vascular disease. Okay, so if it's in the heart, cardiovascular disease. If it's in your legs, peripheral vascular disease, and so on. Okay. Okay, so the middle layer is called the tunica media. And we do find muscle here. Okay, so the media does have muscle. Okay, it's smooth muscle. Okay. And then we have the tunica externa, also known as the adventitia. Okay, and I think I have that somewhere. Yeah, right here. Okay, the tunica adventitia. So tunica externa or tunica adventitia. Okay, so at some point, the artery will give a branch off of itself, the arteriole, which eventually tapers into a smaller tube, capillary. Okay, that eventually will drain into the vein version of the capillary. okay, called the venule. All right, that then drains into the veins and then eventually the great veins. Okay, the tunica media, which is the smooth muscle layer, it does have the ability to constrict or dilate. Oh, my pen's not working. Okay, they can constrict or dilate. And then because it's a blood vessel, we're going to throw in the word vaso. Okay, so you're going to get vasoconstriction or vasodilation. So the smooth muscle gives it the ability to do this. In the vein, okay, it has the same 3 layers. However, the tunica media in the vein is not is thinner. Okay, so the muscle isn't quite as thick. So if you look at the thickness of the muscle on the artery and the thickness of the muscle in the vein muscle is not quite as thick as the artery. Okay, here's the one-way valves. And these are found throughout the entire length of the tube, right? So they're placed in strategic increments over the length of the tube, right? So you might find a valve there, then a valve there, and so on. Okay, so there's lots of valves inside of one vein. And the arrows are representing the direction of blood flow as it works its way toward the heart. And that helps prevent backflow. Okay. Okay, this next thing I'm going to say, just write it down. The arteries, let me just draw you a picture. So the heart pumps blood through the artery family. Okay. So blood in general can get to your body fairly easily because of the pump and gravity. All right, so you're standing there. Obviously, gravity is helping fluid get down to your feet. Okay, now veins don't really rely on the heart pump. It relies on muscle contraction. So skeletal muscle contraction. Okay. So in other words, movement of skeletal muscle squeezes on the veins and the vein families, compressing the tube, forcing blood to advance. You know, very similar to, you know, squeezing like a toothpaste tube, right? You squeeze it, the toothpaste is going to come out in one direction. Okay. All right. So these next ones I'll go through quickly because we pretty much already talked about them, but there's a few more highlights. So the tunica intima, that's supposed to be an N. The tunica intima is made of that simple squamous epithelium. Okay. The blood vessels are elastic. I mean, they do have some elastic components to them, which gives them the ability to stretch and recoil and then go back to where they were. Okay, they do have collagenous fibers. It's supposed to be a B. Collagenous fibers, which provides that smooth surface so that the blood cells and platelets are not damaged. Okay, the endothelium also helps prevent blood clotting by preventing the platelet aggregation.
Really quick, Dr. J, before I forget, I noticed that you're recording this, which is awesome. So where do you put these after lecture?
Well, with some of my other classes, I've just been putting them in the modules.
Okay.
So like, if you go to the module, you'll see, I think you'll see something like week 6, blood or blood vessels.
Okay.
And then it would be in there and it would say, blood vessel lecture. And then I convert it and also post it on the YouTube channel. And then so there's those links, right? You've got the video itself, the YouTube link and all that. But yeah, it gives you access to the video.
Okay, cool. Well, thank you.
You're welcome. Okay, so since the blood vessels do have a motor component to them, okay, so there's your vaso, which lets you know it's alluding to the blood vessels. Okay, motor means there's going to be some sort of movement. So we do have some vasomotor fibers that stimulate the smooth muscles to contract. Okay, so as a result, we get vasoconstriction. So the tube will go from big to small. So this is if you're looking down the barrel of the tube. If it's going to vasodilate, it goes from small to big. It opens up. Okay, now these are constantly occurring in your body all the time. It helps regulate blood pressure and temperature and all sorts of things. And so this is very normal for this to constantly occur. Of course, when this doesn't work right, then we get into problems. Like if you're constantly in vasoconstriction, then you're going to have high blood pressure all the time. Okay, be an example.
So Dr. J, did you say there's smooth muscle and skeletal muscle?
No. The so the veins. So here's a vein tube, okay, with the one-way valves in them. Blood is constantly working toward the heart. So the vein itself is smooth muscle, okay, and that's found in the tunica media. So the middle layer of the tube. In order for blood to be advanced through the veins, you need the skeletal muscle, so skeletal muscle, to contract, which squeezes against the vein, which forces blood to advance even better toward the heart. So the vein is not skeletal muscle, but skeletal muscle is all around the vein, and the contraction of the skeletal muscle helps force fluid through the vein tubes.
Okay, gotcha. Thank you.
Okay, you're welcome. Okay, the arterioles. So from the heart, right, we've got big tubes. and then those taper into smaller tubes, and then those taper into even smaller tubes, right? So now we're in the arterioles. Okay, very similar to the arteries with their layers. They are innervated by the sympathetic nervous system. Okay, so when you see the SNS, that is our sympathetics. Okay, and when you all hear sympathetics, okay, this is something like one of those things you should never forget. All right. So sympathetics, or sympathetic nervous system, what that really means is, in lay terms, is stress, okay, fight or flight. And in order to do this, the nerves have to release epinephrine, norepinephrine. Okay, epinephrine, norepinephrine. Okay, the adrenals help with that. The adrenal medulla helps with that, releases epinephrine, norepinephrine into the blood. Okay. So its counterpart, the parasympathetic nervous system, is your rest and digest nervous system, which means it releases acetylcholine. Okay. And the acetylcholine is what gives you your rest and digest options, such as resting heart rate, calmness, normal heart rate, all that stuff, just everything that's kind of in the rest and digest family. Okay. So those are just things to always keep in mind, like forever. And one of the reasons for that is, so one reason for this is for overall health. Okay. Overall health. Now it's going to be your choice and everyone's choice. Do you want to be pissed for forever or calm? Right? So the more pissed or in sympathetics or stressed we are, then in the long run, that's going to be harmful to your health. The more calm and relaxed that you are, that's going to be just a better lifestyle choice. And you'll see people come in to the hospitals and clinics and whatever, and you can tell they've just had a lifetime of chronic stress. And stress does not have to be just emotional, angry, pissed, upset, whatever. Stress, okay, is also what's included with our sympathetics is chemical, stress, mechanical, okay, and emotional. These are the big ones, the three big ones: chemical, mechanical, and emotional. All right, chemical stress is things like the toxins we put in our body, whether you know it or you don't know it. That would be chemical stress. Like, for example, alcoholism, drug abuse, okay? Foods that are just filled with additives, preservatives, and other, artificial things, and genetically modified, and pesticides, and all that kind of stuff, right? Those are chemicals. So that is stressful to the body. Mechanical is your wear and tear stuff, right? So repetitive motion on an abnormal, just abnormal repetitive motion over time creates arthritis, creates degeneration, creates pain, okay? And all sorts of things that put your body in sympathetics. And then, of course, the emotional side, which is a variety of things. And an easy way of looking at that is stress, okay? And, you know, you can be silly with it and say pissed, angry, just whatever, anything that's in that kind of emotional. And some of that emotional stuff are things that are done because we choose to do it. So there's active and then there's passive, right? So here's an example of passive stress. What the heck we're experiencing in 2020, right? Pandemic stuff, riots, political tension, schools are shut down or, you know, can't go on campus, essential versus non-essential, people losing their job. You know, what I mean by passive is you didn't do that on purpose. You didn't wake up and say, you know what, I'm going to choose to have all the businesses shut down. I'm going to choose to make other people riot. I'm going to, no, of course you didn't. It's happening. So it's passive in the sense that you're not actively doing it, but because you're in society, you're receiving the stress from what the heck is going on. So that would be an example of passive stress. Now, that doesn't mean you have to let it affect you, right? So everybody's different with their boundaries and their stress resistance. Like, for example, if a spider crosses the table on me, it doesn't freak me out, it doesn't stress me out. But for another person, it stresses the heck out of them. Okay? So I'm just saying you don't have to let things stress you out, but everybody's different on how that works. Now, sometimes we choose to be stressful, like you're just angry for whatever reason. Okay, and everybody's different with that. We all have our buttons. We all have our, you know, things that get us going. Some people are super sensitive and some people are not, and everything in between. But all these things fall under stress. Okay? So I'm just saying, just hopefully this is one thing you'll never forget is sympathetics, parasympathetics. If a person is constantly in sympathetics, which means stress, their whole body's going to get hurt. Their blood vessels, the heart itself, the adrenals, everything, the brain, the nervous system. Okay. And as things add up over time, it will eventually catch up to you. It eventually catches up to a person. All right. So now on another note with sympathetics, the one area where this is actually pretty good is exercise. Okay. So when you start exercising, you want your body to be in sympathetics. You want the heart rate to go up. You want circulation to get faster. Okay. You want the metabolism and the mitochondria and the ATP and all that cool stuff to do their job. And you actually want to develop it. So in other words, if you lift weights, get stronger. If you're an endurance person, you know, get better with the running or the cycling or whatever it is you like to do. Okay. And everyone's form of exercise is different, but whatever it is, just keep doing it, you know, and get better at it. So that's a healthy form of sympathetics. And the only other time, and this is my opinion on this, yet you want to be in sympathetics is legitimate fight or flight stuff. That's why it's there. If you need it to protect yourself or run away, you need your sympathetics. Okay. Outside of that, you know, a person doesn't want to really always be in sympathetics. You don't want to always be pissed, always releasing epinephrine, norepinephrine. Okay. All right. The capillaries, these are the smallest in diameter of the blood vessels. We have anywhere from 25 to 60,000 miles of them in our body. Okay, they're a single layer of that simple squamous epithelium. Okay, so it's very thin to allow for exchanges Okay, they are semi-permeable, which means they only allow some things out and some things in. So they're semi-permeable. Okay, areas of high metabolic demand have the highest concentration. So this is kind of shorthand for concentration. Have the highest concentration of capillary beds. So for example, your muscles have a very high concentration of capillary beds. If you develop your muscle, either through strength training or endurance, you will grow even more. Okay, that's one of the ways your body adapts to exercise. Okay, you know, it's kind of a no-brainer, right? If you've never run before in your life and you go out and you run today, it hurts. That first mile just sucks. But if you stick with it, eventually you don't even feel the mile. And now you have to go 2 miles and eventually 4 miles and eventually 6 miles and so on, because you get used to it. Your body adapts. Okay, capillaries also have the shunting ability. So that means they can actually close themselves off if they need to. Okay, and I have a picture of that coming up later. Okay, the gas exchange you find in capillaries, typically oxygen, carbon dioxide, some waste products, and nutrients. Okay, so substances do move according to their concentration gradient. So the higher the concentration of the substance, the more it will move. So for example, if you're exercising and your skeletal muscle starts to increase in its concentration of CO2, okay, which means it's going to need an increase in concentration of oxygen, it will move. There's going to be some gas movement. So take running, for example, and let's just pick on the quad, okay, your thigh muscle. If you start running, the concentration gradient will change because your metabolic demand has changed, because you're using the heck out of that muscle right now because you're running. Okay, so your body's going to dump lots and lots of oxygen to that area and give up lots and lots of CO2. Okay, so things always move according to their concentration gradient. Okay, looking at a picture of the capillary right here. Okay, you can see that the tube is about the same diameter as a red blood cell. Okay, and then things will travel through a blood vessel in one of three ways. Okay, direct diffusion. Okay, gases and hormones. Let me say that better. Gases and steroid hormones typically do very well with direct diffusion. Okay, another one is diffusion through an intercellular cleft. Okay, that you can see here. And diffusion through a pore, as you can see here. Okay, you may see the word fenestration. Okay, so diffusion through a fenestration, also known as a pore. Okay, I thought I had more stuff on the capillary thing, so hold on a sec. Okay, so what ends up happening is it depends on the size of what needs to travel to and from the blood vessel. Okay. So if it's small enough, it'll go through the cleft. If it's big, it will need to go through the pore. Okay. And I have a video during our lab time that we'll watch later on this, kind of shows you how it works for things to go through a capillary. Okay. All right.
Can you start recording again? Oh, never mind. You read my mind.
Okay. Okay. So there's going to be some areas in the body, some very common areas that you'll end up palpating to look for a pulse. Okay. Now the names of these arteries, we'll come back to that. Okay, so after we do some gross anatomy, we'll talk about some pulse and technique and so forth. Okay. As blood is traveling through these tubes, you're going to have either laminar flow or turbulent flow. Okay, so laminar flow is where the blood is fairly continuous. Okay, so there's really not much disrupting it other than the friction that's against the wall of the blood vessel. Okay, so that's what these arrows are trying to denote here is you've got this big tube or arrow in the middle showing that's where rate is the quickest. So in the middle of the tube, the blood flow is the quickest. And as blood is like physically touching the wall of the artery, because of friction, it's a little bit slower, but it's still all smooth and continuous. That is laminar flow. Okay. Turbulent flow is where the blood vessel, now you can see the tube here has a certain diameter, then all of a sudden it goes in, okay, and it changes diameter. And so where this kink is, where the constriction is, blood is now going to kind of swish back on itself. Okay, as you can see from what they're trying to show from the arrows there. Blood kind of, it comes in and then swishes back onto itself. Okay. That is called turbulent flow. And the greater the constriction, the greater the sound of the turbulent flow. Okay. And this is something that you can hear. Okay. You can hear this. And you're going to use your stethoscope to pick up on these sounds. Okay. Now, overall, you can't really hear laminar flow. Okay. Now, if you have some advanced scopes, advanced amplified sound, that kind of thing, you'll pick up on it. But in general, with your stethoscopes and all that, you can't really hear this, okay, because it's smooth and continuous. Okay, so turbulent flow. It's when fluid passes through a constriction, a sharp turn, or a rough surface. Okay. If you do hear a turbulent sound, chances are it's not normal, especially if you hear it in the arteries. And it's likely due to some form of constriction or thrombosis or some other vascular injury. Okay, so this will take us into blood pressure. Okay, so understanding what's going on with blood pressure. Okay, so first of all, you do need some tools. Okay, you need this thing called a sphygmomanometer. Okay, that is a fancy word for the blood. Okay, the blood pressure cuff. Okay, we'll come back to that in a minute. Okay, the other tool that you're going to need is a stethoscope. All right, so once you have these, then you're going to do fairly well with getting a person's blood pressure. Okay, now we do have to talk about you know, more of behind the scenes of what's going on with the blood pressure. Okay, but in general, you just simply take a blood pressure cuff, put it on the person's arm, you pump up the blood pressure cuff, and with a stethoscope, you listen to the sound that everything makes once you you know, pump it up and release the pressure and that kind of thing. And that's the stuff we're going to talk about as far as the you know, more behind the scenes of the technique that's going on. Okay, so going back to that laminar and turbulent flow, this is an area where you are purposefully creating a turbulent flow. Okay, so you're taking the blood vessel in the arm, the brachial artery, and you are going to purposefully kink the tube to create this turbulent flow. Okay, we call that the Korsakoff sound. Okay, so the Korsakoff sound is created, for now we're just going to say, by kinking the tube. Okay, so what happens is you've got this nice big open blood vessel. Okay, now you're looking down the barrel of the tube here. And you're going to take this blood pressure cuff and squeeze it, which means the tube is going to go from nice and open to flattened out. All right. So this is no different than if you're drinking out of a straw, a nice big open straw, and I come up and just simply squeeze the straw, kink it. You're going to have a very hard time getting fluid past where I'm squeezing your straw. That's pretty much what you're doing with the blood pressure cuff. You're just simply kinking the tube. So from another angle here, here's the tube. Okay, and blood is flowing nicely. So that's laminar flow. And then you're going to take the blood pressure cuff and you're going to kink it. Okay, you're going to squeeze it. Now what happens is you're now restricting blood flow. Now at some point, you're going to pretty much shut off blood flow, okay? So now nothing is really getting by. Okay. As you're listening with the stethoscope, you're going to pick up on this sound, all right? So as you release the pressure, you're now opening up the tube. So the tube is going from this kinked to now it's a little bit more open, a little bit more open, a little bit more open until it gets to fully open. All right. The first sound, now this is after you have occluded the artery. Okay, the blood vessel is completely occluded, so no blood flow is traveling through the tube. Now you're going to open up or you're going to release the pressure, and you're eventually going to hear this drip sound. Okay, that's not an official term. That's just my word for it. It's a drip sound. It goes bloop. Okay, so you hear nothing. Then all of a sudden, as you're releasing pressure, you hear this bloop. And as you're releasing the pressure, it goes bloop, 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 bloop. And then eventually you don't hear the sound anymore. So the first sound that you hear, that drip sound, that is the systolic. Okay, so you're likely going to hear that. We'll just keep it simple here at around 120 millimeters of mercury. Okay, and those are the units that we use, millimeters of mercury. Okay. And so when you hear the first sound, you have to be looking at your meter. Okay, and every meter is different. Most of them are the analog looking ones, right? Where you've got the, you know, it's almost like a wristwatch, you know, the big arm and the little arm. So you got a needle, and wherever that needle, whatever number that needle is on, when you hear the first sound, you record that number. And just to keep the math simple, you heard it at 120 millimeters of mercury. That's the pressure. Okay. And so you record that. As you continue to release the pressure, you're unkinking the tube. So then it goes from that blip, 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 blip. And then the last sound that you hear, the last drip sound you hear is the diastolic. Okay, so let's just say you heard that at 80 millimeters of mercury. Okay. All right. So measurements are in millimeters of mercury. The Hg is what mercury is on the periodic table. So that's where they get the Hg from. Okay, now super quick history on the millimeters of mercury. I think it was at sea level. How much pressure did it take to raise mercury? Okay. So how much pressure did it take to raise mercury? Mercury has weight to it. Okay. So for a liquid, it's heavy. So how much pressure does it take to raise mercury? And so that's where this came from. Okay. You can also measure atmospheric pressure in millimeters of mercury. So if you have a change in atmospheric pressure, that means there's going to be a change in weather patterns. Typically, if the pressure drops, bad weather's coming. Okay, that's kind of the norm with pressure change with weather. Okay, and you can measure that in millimeters of mercury. So if this helps, because we are at altitude in Denver and or in the mountains area, so Denver is usually around, kind of its normal is around 630 millimeters of mercury. And as the pressure drops to say 540 millimeters of mercury, and this is your atmospheric pressure stuff, then bad weather's coming. Okay, there's a change in pressure. Okay, so the artery that you occlude is the brachial artery in the patient's arm. When you first put the blood pressure cuff on, it's snug, okay? And then once you start pumping it up, you're obviously increasing the pressure. Okay, now my version of taking blood pressure is more of the EMT version, okay? And that's a quick version, and it's simply just pump it up high. Okay, just get it up there high. For most people, 220 millimeters of mercury is high enough to occlude the blood vessel. Now, there is a formula you're supposed to use, okay? It's actually a very long formula. It takes time to figure out exactly what to pump the blood pressure cuff up to, right? And then you talk to field medics and EMTs and ER people, they're like, just squeeze the crap out of the tube, just pump it up, okay? So in general, 220 millimeters of mercury is enough to occlude just about everyone's blood vessel. Saves you time. You don't have to do all this math, all these calculations. All right. But if a person's blood pressure is that stinking high where 220 isn't going to do it, then just keep pumping it up until you've occluded the blood vessel, because you can hear the sound, right? So your stethoscope is over the artery, you've pumped it up to 220, and you still hear a Korsakoff sound. You're like, holy crap, this person's blood pressure is crazy high. That's okay, just keep squeezing until you've completely occluded the blood vessel. But for most people, and in general, 220 is enough, okay? So then you start to back off. So in other words, you start to release the pressure, listen to the sound, record your numbers. I've got a video on this later that I'll have everybody watch. I'm also sure by now you guys have done this, okay? Obviously this is difficult to do a hands-on just by talking about it, okay? So anyway, we're going to talk about it academically. All right. Okay, so here's a concept question. If the blood vessel dilates, will the resistance of blood flow through the vessels increase or decrease? Okay, if a tube is really big, the diameter is really big, is the resistance of blood flow through that big tube increased or decreased?
Decreased.
Good. Okay. So here's the pump, right? So there's your heart, and it's pushing fluid through a nice big tube. Okay. The bigger the tube, the less the resistance. Okay, let's go back to our straw analogy in a drink. If I gave you a really big straw to drink the fluid from, you don't need a lot of pressure to get the fluid through the straw. It's very easy. Okay. If I give you a super skinny straw, like one of those straws you use to stir coffee, and you try to draw fluid up through that skinny straw, it takes a lot of pressure, right? So when the tube When the tube, so here's your heart, and now the tube is really skinny, okay? You have to increase the pressure or increase pump to force fluid through that tube, okay? So in other words, if it's a really big tube, okay, the resistance goes down. It doesn't have to work as hard. If the tube gets really skinny, the resistance goes up. All right, now that's also a concept you should never forget, especially those of you who are going into hospital situations, whether it's ER and cardio. Oh my gosh, you're gonna see this like crazy, okay? So the hemodynamics and understanding the basics of pressure is very important, okay? And it will help you help your patients even better, once you understand this, all right? So clinically, if a person has nice and big dilated blood vessels, their blood pressure is going to go down, okay? But it can go down too much. Your blood pressure can be too low. So it's nice to have low blood pressure, like a healthy low blood pressure, but even that can get too low, and that's dangerous. Their blood pressure can also go up, okay? And one of those reasons could be because the blood vessels have constricted, okay, vasoconstriction. Now, there's a ton of things that can cause high blood pressure and low blood pressure, lots and lots of stuff. Okay, we'll cover more of that in pathophys. But for right now, since we're in the tubes, this is one area that can contribute to high blood pressure or low blood pressure, depending on the diameter of the tube. Super skinny tube, lots of pressure, lots of resistance. A big open tube, there's less pressure and less resistance. Okay. Now, exercise affects this. Typically with exercise, you're going to get an increase in heart rate and an increase in blood pressure, an increase in stroke volume, and an increase in the diameter of the blood vessel. Okay, viscosity of blood means thickness, so how thick the blood is. Okay, so viscosity will also influence the pressure. So if you increase in thickness of the blood, you're going to increase pressure, increase resistance, okay, which means the heart has to work harder, okay. So if blood is thinner, okay, if blood is thinner, then the pressure goes down and the resistance goes down, so the pump doesn't have to work as hard, so blood pressure goes down. And we compare this to distilled water, which has a thickness or viscosity of 1.0, and you would like blood to be around 3 to 4.5 in its thickness. So in other words, it's about 3 times. So the heart, if the heart only pushed water, okay, the pressure, the pump only has to work so Hello, everybody.
Yeah, I think we lost you for a second there.
Yeah, I saw that. Okay, what was the last thing y'all heard?
We were talking about viscosity.
Okay, all right. Well, let me get back to it. Okay, so yeah, so viscosity is the thickness of blood, and water has a viscosity of 1.0, and whole blood has a viscosity of 3 to 4. So the heart has to work about 3 times harder to push blood through your system, to push blood through the arteries and veins than it would be to push water. Okay, which
Will you
obviously.
share your screen again?
Okay, there we go.
Thank you.
Yeah, you're welcome. All right. Okay, so viscosity is also influenced by the hematocrit level, which is how many red blood cells you have. Okay, so in super easy terms, the hematocrit is just how many red blood cells you have present. Okay, a fancy way of saying that, the percent of total volume of blood composed of the red blood cells. The more red blood cells you have, the more it increases the viscosity. So that's why blood doping is not a good idea, because it will dramatically increase how many your hematocrit level. Okay. Also, there's some people, because of diet and lifestyle, their viscosity of blood can go up to 8.0. You know, I've worked with some of these people with my functional medicine side of what I do. So they come in, they have this high blood pressure, and they're on all this medication. But then we find out, it's like, good grief, your blood's too thick. Okay, so then we start working on things to get their blood back down to 3, somewhere to between 3 and 4. Okay. The plasma also plays a role in viscosity. Okay, so dehydration is a big part of that. All right. So, you know, remember, all this stuff is connected, right? The heart, the blood vessels. So there's likely going to be some people you're going to be working with that's going to have some cardiovascular issues, and some very simple advice that can help them out is some diet and lifestyle stuff, right? So just staying hydrated is one of them. So as viscosity increases, the workload of the heart would increase. Okay, and if the workload is great enough, then you're going to start to get some heart pathologies and also blood vessel pathologies. Okay. So heart pathologies and blood vessel pathologies. Okay, critical closing pressure, Laplace's law, and compliance. Okay. Now, one of the main reasons why I have this on here is you'll likely see this on NCLEX boards. Okay, Laplace's law, which is the force acting on blood vessel wall is proportionate to the diameter of the vessel times the blood pressure. So that's the formula. Force equals the diameter times the pressure. Okay. And if you're like, what the heck are you talking about? Well, in layman's terms, if the blood vessel wall is small versus large, okay, then the force changes. So this is the stuff we were talking about earlier. So Laplace's law is basically saying if the tube is really skinny, the pressure goes up. If the tube is really big in diameter, the pressure goes down. Okay. Now, Boards isn't going to say it that way. They're not going to put it that simple. All right. They're probably going to use the formula. The force acting upon the blood vessel wall is proportionate to the diameter of the vessel times the pressure. Okay. But what they're really saying is if the tube is really skinny, the pressure goes up. If the tube is really big, then the pressure goes down. Okay, we have this thing called an aneurysm where you can get an unusual bulge. So here's a healthy blood vessel. And an aneurysm is where the blood vessel starts to bulge. Okay, so that would be the aneurysm. All right, now that obviously is dangerous because at some point this thing can break or tear or rupture, which means now you're going to get bleeding. And depending on the nature of the tear, you're either going to get a little bit of bleeding or a lot of bit of bleeding that can be fatal. Okay, and everything in between. We talk more about that in patho. Okay, and we get into the different types of aneurysms and whatever. But for now, the quick version is some people can get a weakening in their blood vessel wall. Okay, so the blood vessel wall can start to get weak. And the integrity changes. So as a result, it can start to bulge. Now, at some point, they may get symptoms. Okay. And so this is where angiograms and other imaging and other cool stuff comes in to try to figure out what's going on. And then once you figure it out, then they can get the appropriate help. I've caught a few of these in my time and caught them through x-rays. Sometimes the blood vessel is so damaged, you can even see it on x-ray. And you're looking and you're like, holy smokes. Okay. Starting to get an aneurysm there. So then I send them out to get that, to get a second opinion on it. Because some aneurysms, even, medically, they're like, yeah, it's there, but there's really nothing we can do at the moment. Okay. And then as time goes by, they keep an eye on it. And as time goes by, as it gets worse, then they start to get in there and do, their repairs and whatever. And if you might be thinking, why? Like, why wouldn't they fix it? Well, here's the quick answer to that. It's usually insurance. Okay. I hate to say that, but insurance basically says, oh, they've got a problem. Well, it's not bad enough for us to want to pay for it yet. So we have to wait till it gets worse. Then we'll pay for it. Okay. So that's a whole game. Sometimes you have to play with insurance. Believe me, I deal with that all the time. Hip replacements are like that. Oh, look, you have a degenerated hip. You need a hip replacement. Yeah, but it's not bad enough. We have to wait for it to get worse. And then we'll pay for it. It's like, okay, whatever. So anyway, if that was a thought in the back of your mind, sometimes it's an insurance reason. Okay. All right. Critical closing pressure. It's pressure at which a blood vessel collapses and blood flow stops. Okay. This is now shock. Okay. The bottom line with shock is anytime you get a decrease in blood flow. Okay, now there's a variety of different versions of that we get into in patho. But the bottom line, what all shock has in common is you are messing with blood flow. Okay, the blood vessels, and it could be because of a blood vessel problem. It could be because of a heart problem or whatever. But either way, critical closing pressure is where a blood vessel collapses and blood flow stops. And now you're dealing with shock. Okay, vascular compliance. It's the tendency for a blood vessel volume to increase as blood pressure increases. Okay, so in other words, especially in your veins, okay, veins are really good at this. Let's just call this a relaxed vein. Okay, so as you can tell, the diameter is only so wide there. Now, a vein can have a lot of volume get put in it. You can squeeze a lot of blood into a vein tube. And what will happen is it expands. Okay. So the vein can actually open up pretty big. So that is vascular compliance. The tendency for a blood vessel, especially veins, for the volume to increase as the blood pressure increases. Now, arteries can do this too, you know, but veins are really good at this. They can really expand, lots and lots of compliance in a vein. Okay. And then the definition of compliance in this case is where the blood vessel wall can stretch. It can really open up. Now look at this. In veins, the compliance can be 24 times that greater than of an artery. Okay, so that's what I meant earlier by veins are really good at this. All right. Now check this out. In some people that receive shock, that get shock, you might get confused. It's in the hospital setting. You're like, their heart's fine, the blood, like everything's fine. What the heck's going on? And then you realize, oh, there's so much blood in their vein system. There's so much compliance. 24 times the amount of blood is now accumulated in their vein system. That's why they're experiencing decreased circulation. Because remember, shock is where blood flow stops or is dramatically decreased. And one of those really tricky ones in an emergency setting is when a person's in shock and everything seems fine. You're like, what the heck? And then you find, oh, that's because all the bloods are hanging out in the veins, because the veins can go from, this big to this big and just hold all the blood. Okay. All right.